Have you ever wondered what causes clinical depression? Perhaps you have been diagnosed with major depression, and that's made you question why some people get depressed but others don't. Depression is a complex disease. No one knows exactly what causes it, but it can happen for a variety of reasons. Some people have depression during a serious medical illness. Others may have depression with life changes such as a move or the death of a loved one. Still others have a family history of depression. Those who do may have depression and feel overwhelmed with sadness and loneliness for no known reason. What are the main causes of depression? Lots of things can increase the chance of depression, including the following. 1. Abuse. Physical, sexual, or emotional abuse can make you more vulnerable to depression later in life. 2. Age. People who are elderly are at higher risk of depression. That can be made worse by other factors, such as living alone and having a lack of social support. 3. Certain medications. Some drugs, such as isotretinoin, the antiviral drug interferon alpha, and corticosteroids, can increase your risk of depression. 4. Conflict. Depression in someone who has a biological vulnerability to it may result from personal conflicts or disputes with family members or friends. 5. Death or a loss. Sadness or grief after the death or loss of a loved one, though natural, can increase the risk of depression. 6. Gender. Women are about twice as likely as men to become depressed. No one's sure why. The hormonal changes that women go through at different times of their lives may play a role. 7. Genes. A family history of depression may increase the risk. It's thought that depression is a complex trait, meaning there are probably many different genes that each exert small effects, rather than a single gene that contributes to disease risk. The genetics of depression, like most psychiatric disorders, are not as simple or straightforward as in purely genetic diseases such as Huntington's chorea or cystic fibrosis. 8. Major events. Even good events such as starting a new job, graduating, or getting married can lead to depression. So can moving, losing a job or income, getting divorced, or retiring. However, the syndrome of clinical depression is never just a normal response to stressful life events. 9. Other personal problems. Problems such as social isolation due to other mental illnesses or being cast out of a family or social group can contribute to the risk of developing clinical depression. 10. Serious illnesses. Sometimes, depression happens along with a major illness or may be triggered by another medical condition. 11. Substance misuse. Nearly 30% of people with substance misuse problems also have major or clinical depression. Even if drugs or alcohol temporarily make you feel better, they ultimately will aggravate depression.